Okay.
Hello, everyone. Thank you, Gordon, for coming. I was anticipating more people to join this Zoom session. I understand it's Friday evening. It's optional. People have some commitments, so um, we'll keep it short. As Gordon, you and I have been discussing about some things around assignments, about assessments, and we did not record it because it was not specifically relevant to this Zoom session because this session is about just content. Um, Given we don't have anyone here except Gordon, what I'm going to do, I would just talk a little bit about clinical impression and mental status exam. What I'm going to do, I'm going to share or show and share a template with you around initial assessment. But I want you all to know that this assessment template varies. So if you're working for an organization, there may be some questions that are different. If you're working for an adult population, some questions might be different. However, overall, the basic information is the same. So I'm going to share my screen and I'm going to go through them quickly and just note that it's it could the one you would be doing may be in a different format. Um, so I'm going to share my screen here. Okay. Okay. So let me move this right here. Okay. So Gordon, you can see my screen, correct? Perfect. So this is the assessment template that I have had used in the past. Uh, and the assessment template I usually use depending on my clientele population. Is it a young person? Is it an adult? It's a senior. So this is pretty common. Identify information. So client's name, date of birth, age, gender, allergies. I mention allergies here because it's important. Uh, because mostly these reports are read by health professionals, so family doctor, when you write a report, pediatrician if you're working with a young child, and sometimes some people need pharmacological treatment medications. So if this information is right there, the doctors will ensure that to make sure uh, they know about their allergies and current medication. If it's a young person, you can say school or grade. Now, the reason for referral or the presenting concerns. So we need to be very specific around that. For example, who referred them? What was the reason persons identify concern? Or what was the referral persons identify concern? Is the referral reason well defined? If not, explore this in order to establish what the purpose of this assessment is, right? Uh, is there a specific referral question? Does he have ADHD? So these questions, sometimes you will receive a referral from school, from work, or from somewhere else. So these questions you can ask them for clarity, like, thank you, I received a referral for Johnny. I'm wondering if you can just provide more specific information around your presenting concerns. Because I've seen that personally receiving referral from family physicians, sometimes there's only one word, uh, depression, anxiety, presenting concerns, uh, family relationship. So I think it's important to clarify from the agency that's making your referral, as well as when you meet with a client, you can ask them what are their presenting concerns. So does identified person have their own goals or expectation for service that differ from the referral reason? So in the past, I have received where doctor might say, hi, can you please see Johnny for ADHD symptoms or for ADHD treatment? Meet with a client, and the client says, well, I'm so concerned about my anxiety. Okay, how about ADHD? No, I don't. It's anxiety, right? So then personal or family history. Like this is a very in-depth report. So you don't have to go into in-depth, right? So that's what I'm saying. It's very, very depth. So usually the question I might ask is parents' marital status, if it's a child, if it's an adult, their marital status. And these are the most important questions here is history of psychological psychiatric concerns in immediate family. This is an important question to ask. If it's a child, it's very important to ask a question about custody, um, guardianship, um, History of learning problems in other family members. This is also important. This will give you some information about, okay, so Johnny is struggling with learning this difficulty in mathematics and science. Dad has the same concerns as a child, right? Uh, Now, history of psychiatric symptoms, as I said, again, very important section. So asking questions like, when did the problem start? How old were you at the time? And why are they seeking help at this specific time? What has changed? So they might say, oh, yeah, I've been struggling with this anxiety for over 7 years. But initially I thought everyone feels this way. But when I started my job, I noted that everyone doesn't feel this way. It's just my perception, right? Something like that. What are the predisposing factors? What are some of the precipitating factors? What are some of the perpetuating factors? And even what are some protective factors? Oh, this helps me because uh, I get all my work done. Although at the very end, I submit all my assignments because it pushes me. And how frequent is this problem? So, and now there are so many. I'm not going into the details. Uh, and then developmental history, which is important if you have not captured that information uh, previously, or then adult was referred to you, but you did not have that history. So it's important to understand the prenatal or neonatal history. Uh, it's easier to collect this information if you're working with a child and youth because you can contact their parents, caregivers. It's difficult if you're contacting working with an adult because then how are you going to reach to their parents, right? You might have to ask them if they're aware of their prenatal history. So this is important. Any problems or complications, any prescribed medication or non-prescribed drugs taken. This is very important as well. And about substance use, smoking, cigarette. It's important about type of delivery because it might tell you whether it's complicated, whether it was C-section, um, natural delivery, uh, any distress during delivery, weight and length at birth, not so important, but these some other questions are quite important. Early developmental milestones, important like sitting, crawling, walking. First words, if you're suspecting that you're working with a child and they are not talking, so that means they're having some, could be speech, could be, you never know, right? Could be autism flags. So these are questions that can help you, specifically if someone is identifying autism or you when you're asking them the question, you're having the feeling, so you could ask them all these questions about short phrases, toilet training, social development, like pointing to objects, pretend play, emotional development, education history. You can ask if it's a child or youth, ask about in detail the school attended, education. If it's an adult, just ask them about their educational history. That might help you understanding, oh, did they have any learning difficulty, right? Uh, because if they might say, oh yeah, I graduated high school, but I was struggling in science and math. So you can ask them follow-up question that, did you get some help when you were struggling with those things? Now, this might also help you because they might be, because of this learning difficulty, they might be experiencing anxiety, and that could be the reason they didn't pursue higher education, right? Something like that. So that's important. Uh, Not so much like attendance and all that. Like it's important, but not for adults. Relationship with teachers, any problems with school. Another thing that's important is, did they have any IEP, individualized education plan in place? Did they have a behavior support worker? Did they have SLP? Now, sexual history, this is a very private question. So you always let your clients know that you are going to ask them some private information, uh, which might be uncomfortable to answer, and say that your intention is not to get into their personal life. However, you need this for the purpose of assessment. So you need to have that something kind of a disclaimer. So so that might help you like on sexual history. Are they sexually active or not as a child, or sorry, as a youth? If they have any preferences, identity. So that might help you if they said, yeah, I don't know, I struggle, I don't know if I'm a girl, if I'm a boy, right? So is it gender dysphoria, right? Uh, Substance use, I think also we need a bit in depth here uh, about type of substance, frequency, uh, if they have any history of substance use, at what age they started. So if they say, oh yeah, I've been smoking cannabis since I was 12 and now they're 29. So that might tell you that maybe the challenges they're experiencing, that could be because of prolonged use of substances. Um, and then you don't have to go into describe stages of change. Uh, the initial assessment, maybe you can ask these maybe in the next session where if they bring it, yeah, substance use is a concern. Legal issues, it's important to ask, is there any, if they have any previous or current involvement with law, any probation, legal system. Medical, I think it's important. I would focus more on any injuries like head injuries, seizures, hospitalization, uh, any like you can ask here too, any medical like medication. You can document the medication here if they've taken medication for a specific condition, because this would be helpful if they said, oh yes, I had a head injury 4 years ago. So that might help you understand, oh, that's why this person's memory is impacted. It's not that that person has ADHD or has Alzheimer's, right? It's because of an accident. Current functioning, very important. So this will give you so much information. So in current functioning, we always ask question about sleep. So we ask a question about sleep onset, sleep maintenance, quality of sleep. What time do you go to bed? How long does it take you to fall asleep? Do you sleep through the night? And then if you are doing a screening for anxiety or asking, you could say, when you're not able to fall asleep, what do you do? Do you ruminate about things, what's going to happen in the future, what happened in the past? So that's why this sleep is important here. Then you can ask other questions around anxiety, depression, if the person is presenting with. Appetite, again, this is so important. You can just ask maybe one or two questions that, how's your appetite? Are you eating normal? Do you notice that you're eating less or more? Again, I I keep that in the back of my head as as I'm going to ask them more question about if it's anxiety, depression, or something else. So it's important for the appetite, right? Uh, Mood. So you can ask them about their mood. How's your mood? And now this again is going to help you because if they say, "Oh, I'm happy," but their affect is flat, their story tells you something different. So there's this discrepancy, right? Or they say, "Oh, my mood goes up and down." Now, now then you have to explore more later because is the mood fluctuation showing you that this person may have symptoms of bipolar disorder? So you have to ask those questions. Or this mood swing is because this person may have, say, ADHD, this person may have depression, right? So those things I always keep in my mind when they tell keep take notes, and then I ask them those questions like when I do my assessment further. Current school work, you can ask them how's work, how's school, um, and all that. Work, if they're working, how's work. Family relationships, here you can ask them question about how's your family relationship like. So they, and because in the family history, you ask all question about siblings, parents. Here you ask them to see if there are any protective factors, or is the client feeling such way because of family's challenges, right? Uh, Again, any changes in family relationship. So uh, Johnny started to act after his mom started dating someone, right? So something like that. Uh, Social relationship, again, very important. So you're working with an adult, you can ask, so what's your social friendship? Do you have some friends? Do you participate in social groups? You can ask, again, the child or the youth or the parent. And now, mental status. So this is important. Again, I said this is another important section. And I can see the time. I was talking to Gordon about some other things about his career, about his work. So, and then I was waiting for other people to join. So we spent majority of the time talking about those stuff. So still have a few more minutes to talk about clinical impressions. Uh, so going back to mental status, it's important because mental status basically is more so subjective. It could be objective too. So for example, grooming, what their grooming tells you, right? Because if the person is experiencing psychosis, they're very depressed, you might notice their grooming is neglected, right? And this is very subjective. So when you write your mental status, you have to be very mindful because your client will read. Don't write that, oh, the client appeared homeless, because you're labeling the client, right? Uh, or yes, so you could say that their grooming appeared neglected, which is a fact, right? If you notice that, or you could say the client appeared stated age. Um, and in the personality appearance, you could even mention about any self-harm. The client had minor laceration on the right arm, or the client had severe cuts or laceration on their or arm, right? Eye contact, again, cultural piece. Some people don't maintain eye contact, but then you can mention that if you want to. Like, how was the eye contact? Is it intermittent? It was good eye contact. Because someone who has anxiety or depression, they might not make good eye contact with you, right? So behavioral functioning. So during that time, how was their behavior? How was their rate or tone of speech when they were talking to you? Uh, in the behavior, even you could include any psychomotor agitation. You notice the client was just shrugging their shoulder, right? Or you notice they were cracking their knuckles. Did you notice they were tapping their foot? So all those behavior, right? Uh, Cognition. This is very important. So I can maybe send you something, or we can talk about it. You have to ask them question about their orientation, about their memory, because as a counselor, you're not just collecting information, you're checking their memory too, right? Just to understand if there are any underlying issues around that. So uh, cognition, thought content, and process, very important. Uh, did you notice if they had any obsessions, any hallucinations or delusions? I was working with this client, and the client said, I asked them, so I think the question just came up about how was your weekend? Oh, I went to a friend's house, and then in his garage there was a small box, and I noted that there were small bugs, and they started crawling, and then they went inside my body, and then they become bigger. So I'm like, okay, so I have to make sure, like, or you notice that your client is like, are they hearing voices? Are the voices telling them something? So you can ask them, oh, you're looking upstairs. Like, what, do you like my ceiling? Do you like the window? Or like, just, you could be really funny. Would you like something? I remember one client was like laughing. I'm like, is someone telling something to you about me? And they said, yeah. I'm like, do you want to share with me? They're like, no. So I understood, right? That this is serious. Thought content, how was it? Did you notice that there were flight of ideas? They were talking about this thing, then they start talking about this. Um, Risk assessment, suicidal ideation. So this is, you could create a separate section, and I've just added substance use too. I just old template of abuse, substance use. Now, clinical impression, most important. We'll spend a few more minutes here. Uh, so clinical impression is the heart of any assessment. Anyone can collect this information, like demographics, history of presenting concern, family history. I often send, I have a 5-page questionnaire, or a family information form, I call it. I send it to the family. So that information is important, but clinical impression, as I say, is the heart of any report. And this is your section where you would write your clinical impression. Client might say, I have anxiety, I have depression. Based on your assessment, you might say, looks like it's just an adjustment disorder, or the client is struggling with adjusting to the new environment, and that has increased their level of anxiety. However, they don't meet the criteria for anxiety disorder, right? This is your section. And then if your records are subpoenaed. If you, I never, luckily, but so you will be questioned on this, and you will be questioned on your skills, whatever you write here. So make sure in the clinical impression you're not repeating what client class said. You're not adding new information. What you will repeat, you would just say in one line, for example, Johnny is a 29-year-old pleasant young man, or Johnny is a 29-year-old. If you notice some hyperactivity, energetic, I use some good words like some positive word, energetic, pleasant, right? Uh, so this is important. So you could say that Johnny is a 29-year-old man, women, uh, transgender persons, whatever, presented at or presented to your counseling office for concerns regarding blah blah blah. One line, because as I said, when you will be writing this report and sending it to the family doctor or some other professionals, they don't have time to review everything. They just flip the pages and say, okay, Gordon's clinical impression. Okay, okay, quickly. And what's Gordon's recommendations are done. Uh, Personally, I've done that. Like I received psychiatry report for a client. I don't have time, right, to review everything. I'm just going to go on the clinical impression. Okay, that was a concern. These are the recommendations. So in the clinical impression, then you will write that Johnny is a pleasant 29-year-old man who was referred to to XYZ clinic by his family doctor for concerns regarding. So now it's clarified, is it a self-referral? Was it was referred by a family doctor, by the employer? So that's one line, right? Summarize the reason for referral. And do not introduce any new information, but whatever information you have collected. So for example, uh, and now you can write that Johnny uh, Johnny has had several losses in his relationship uh, that has significantly impacted his ability to trust other people. Uh, as a child, Johnny was teased, bullied by other people, and that impacted his self-esteem. And in order to cope with bullying, Johnny started using cannabis. Now, it's not a new information; it's everything that Johnny told me, and I'm capturing it, writing it in a clinical way. Johnny might say, "Oh yeah, I smoke pot, I smoke weed." Well, these are not clinical terms. So don't say, yeah, Johnny smokes weed, cannabis. Uh, oh, don't say, oh, Johnny, the alcoholic youth, or the right. Just be respectful. So Johnny, who is struggling with some substance use challenges, uh, inform something like that. Here, if you have done any testing, you may you may support your clinical impression. So you could say that, say, back depression inventory was administered and the scores were elevated for negative thoughts, negative self-esteem. You can do that here. In a clinical impression, you can create another section called testing. And then in the clinical impression, you can add recommendations, or you can create a new category saying recommendations. What are your recommendations? So the recommendations could be referring Johnny to alcohol and substance use counselor, referring Johnny to, so I'll just stop it here so that, referring Johnny to psychiatry, right? Um, so all those things, sorry, I don't know where this button is. Uh, okay. So yeah, you can mention all those in your recommendations. Recommendation could be Johnny may benefit from say cognitive behavior therapy, or Johnny may benefit from dialectical behavior therapy to address concerns regarding this, right? Or the recommendation you could say Johnny may benefit from a sleep assessment to rule out sleep apnea, whatever it is. So So I think these are some things I wanted to share with you guys. I do hope that you found this information helpful. And if you have any questions about content of the course, feel free to reach out to me. You have my email address. You can ask me if it's a general question, as you have been doing it. Like post it and ask the question. Uh, yeah, and what else? Yeah, just want to add one more thing here. I was talking to another student. Just wanted to remind you that please make sure you are not using copyright assessment for the next assignment. Uh, and you will find more information on this in your course syllabus. Uh, Gordon, I don't know, somehow you're back, your
There we
camera.
go.
Yeah. So yeah, that's it. Do you have any question, Gordon, since you're here live? Any question, any comment?
Yeah, just a quick question about if a client is telling you that they have dyslexia, would you put that under the educational part or the medical part?
Well, it's up to you. You
Hmm.
can put that in the medical history,
Okay, yeah.
and in the education history, you could say that uh, Johnny Johnny received support from a school since he has dyslexia, something like that, right?
Yeah.
So I would say it's not repeating, because in education you're talking about what support that person received.
Hmm.
In medical history, you're telling about what the diagnoses are, right?
Yeah.
Or any injuries or any accidents. And the reason why we do a head injury is because in our mental health field, we need to make sure the cognitive abilities are not because of accident, right?
Yeah.
Right. So
Yeah.
yeah,
Yeah, that's great. The other question is just really about referrals as well, too. So sometimes people might say, "Oh, my friend found your website and referred me." Is that the kind of, or my parents said I should come see you? That's their
yeah,
referral or
yeah,
whatever. Do
yeah,
you put that in the referrals as
yeah,
well? Yeah.
yeah. You
Yeah.
could say that, like, Johnny attended this intake on the recommendations of his friend.
Hmm.
Yeah,
Okay.
so that you can join. I think that's important because we need to know who referred them, right?
Yeah.
Because
Yeah.
then you're saying that Johnny was referred to your company, or sorry, your organization agency,
Hmm.
by his parents, or on the recommendations of his friend. And then you notice that Johnny is not interested in counseling. So what that tells you,
Yeah.
right?
Yeah.
So I think I would put that, the reason for who referred them. Um, and then when you do the consent, you could say, okay, oh, I just saw that your friend referred you to us. I wonder, do you want me to share all the information with them? Although we can keep it confidential. It's that consent to collect and disclose. So
Hmm.
always remember, what I personally do, I always complete a consent to collect separate and a consent to disclose information.
Okay.
So consent to collect, the client gave me the information. The client gave me the consent to collect the information from school, from doctor, from work, but the client did not give me the consent to disclose to my employer other than the attendance.
Mm. Yeah.
So if have it separate, I know. Otherwise, I will call and tell them everything, right? And then it's a breach
Yeah.
of confidentiality.
Yeah. Yeah.
So I would do separate. Another thing is, like, some people do is they do a separate consent form for each agency that the person has identified, so that the other agency does not know that, for example, Johnny said, I'm okay, you talk to my school, you talk to my employer, you talk to my parents. I even put parents, like, if it's a young person, I always say that they're consenting me to talk to their parent, to collect information, to disclose. Because if you put everyone's name on it, and then the employer says, oh, okay, so Johnny sees a specialist. Okay, do not tell us. Oh, okay. So they start, oh, Johnny sees a specialist because of some neurological problems. Oh,
Mm.
that
Yeah.
means Johnny might be off work for 2 months, 3 months. That means, you know, so just be
Yeah.
careful around that confidentiality, as we do
Hmm.
care for our confidentiality. Uh,
Yeah.
Yeah, and just check from time to time that are you still okay, right? And then
Yeah.
document that. Yeah. Yeah. Any other question, Gordon, before we close?
No, I
Yeah.
think those are the main ones. That's great. Thanks. This
Yeah.
was really helpful. So
Yeah. You're welcome. And then,
yeah,
yeah, feel free to reach out to me. I know this is the almost end of the what, fourth week?
yeah, yeah.
Wow. Yeah. Time flies super. I know even I can see the fast pace of the courses, right? They're
Hmm.
like this, they fly like first, like fourth week. But remember, you still have what, two big assignments
Yeah,
and one DQ. Uh,
yeah.
uh yeah. So yeah, almost there, but still it's going to take a few days, right? So
Yes.
I would suggest just, keep that positivity, keep that energy with you, because you guys have been putting so much hard work, right? And
Hmm.
last thing I want to add here is like, just think about your circumstances, the work you're producing, right? The work doesn't define you. The work that you're producing is because of the circumstances you're having. You might have children, you might have family, you might have to take care of your elderly family members. You might
Hmm.
have to work a lot to cover for the tuition for this course. So
Hmm.
if you are not able to put everything, like say you receive 75% or 80%, and then you're like, oh, I should get 95%, but maybe your circumstances are not that you're able to produce the work of that quality level. But that doesn't mean you don't have the skill set, right?
Yes.
So
Yeah.
I think that I would look at from that perspective is like, okay, lastly, you guys have had so many courses with YU. Uh, some might think, oh, I'm not getting good marks in this course, or I'm getting not as great as I thought. I want to say every course is different, right? Every course is different. Every course tests you on different skill set. It might be possible that for this course you needed more time, which you did not have, right?
Hmm.
So, and I know you all will turn out to be great counselors, uh, because you're putting so much efforts, and some of you went through so many things in your life, right? So like how I can help those people. Um, so yeah, thank you so much, Gordon, and other people who would be watching this, and we'll be in touch.
Okay. Thanks, Dr. Jane.
All right, thank you.